Hi everyone, welcome to the All Hands On podcast. Today, today's episode is the second part to Lynn, and it's meaningful because her story reflects survival, resilience, and purpose after sudden cardiac arrest.
In this space, we talk about all things sudden cardiac arrest and mental health, resilience, fear, healing, advocacy, and what it means to support survivors and their families through life changing moments. If this topic feels close to home for you, please let me know that you're not alone here.
Okay, so for the second part, we're going to talk about your advocating, your starting hearts, your book, and saving lives.
So, at some point, you finished your story shifted from survival to purpose. What made you decide that you wanted to turn your experience into action and help save other lives?
Well, I'll never forget my mom when I woke up in the hospital and she explained what had happened to me. In fact, and I know that a lot of survivors have a little bit of a memory lapse, and so when I was in the hospital recovering, she had to tell me repeatedly what happened because I would be like, "Wait, now why am I here? What's going on?" And so there was one time that she looked at me and she said, Lynn, the fact that you survived, the fact that Sue was, reported to work on that day, she wasn't supposed to be there. The fact that you were across from the fire station, the fact that you were not on your honeymoon, or, if this would have happened at any other time. I mean, if I was on my honeymoon in St. Kitts in my husband's presence, he would not have known how to perform CPR. And I just, thought, wow, all those coincidences, didn't just happen for a reason. I just feel like, well, actually, I'm sorry, my mom in the hospital, she said, all of these things did not happen just by chance. Your
Mm-hmm.
life was saved for a reason, is what she said to me. And she said, I know that there are big things for you in your life. And I kind of, it spoke to me when she said that. I thought, maybe my life was saved for a reason, and there is more of a purpose for all of this in my life, and just the fact that it happened on Valentine's Day, and this reality TV star, performed CPR, and all the things. It just seemed too amazing, really, to not have more of a purpose. And so, I tried to go back to life. I went back to my new job at the Vail Valley Partnership where I had, just started working. And, my poor hiring manager, because first of all, they had waited, for me to get married and to go on my honeymoon and come back. So they held this position for me. And then after I had my cardiac arrest and the doctor said that I couldn't work for several weeks. And, then they held my position for me for another, 6 to 8 weeks while I recovered, so they were waiting for me to, come back and really get started working. But, when I went back to work, it was a very odd situation. I didn't know any of these people before, I mean, I had only been working there for a few days. And so, coming to terms with the fact that I had, experienced cardiac arrest in front of all these people and who knows what they saw, I mean, of course, my bare chest was probably exposed and, this was a very traumatic experience for them too, watching, so to see me come back um, they were very sensitive and and
Sure.
rightfully so,
Right.
not knowing me well enough, and so I never felt comfortable in that job. And, I just felt like I feel like I was here for that day, for that moment, for my life to be saved, and I didn't feel like I was really being challenged, and I didn't honestly have the energy and the stamina that I had, previously. So it was difficult for me to feel like I was making a difference and doing a good job. And I finally came
Right.
to terms with the fact, what, I think I need to move on and just put this behind me because, being involved with those people. And fortunately, the office location ended up moving to a different area. So it was no longer, the site of the incident. So, fortunately, I was able to let that go. But still, just being with those people and it just didn't feel
Yeah.
right after that. And so I thought, my mind kept going back to what my mom said in the hospital, your life was saved for a reason. There's a purpose. And so I really just kind of
Right.
tried to move on. I actually ended up finding another job and kind of worked for a few years, but this was always in the back of my mind. And finally, in like 2009, I had a job and had the opportunity to basically take a voluntary um, cut because they were eliminating people. And so I thought, you know what, maybe this is my opportunity. I really don't have anything to lose here. And so um, stopped working for that organization. And while I was looking for other jobs, I just really felt like, okay, there is something that I need to be doing. And that's to save lives, which is what that purpose that I mentioned earlier, saving earthly lives. And so I had no idea what I was doing. In fact, I didn't know what cardiac arrest was when I experienced cardiac arrest. I had never been trained in CPR myself. And I thought, okay, well, it needs to start with that. I'm going to learn CPR. So I took an American Heart Association certification class and it was first aid as well. It was like an 8-hour class. And I thought, oh my goodness. And I hope no one ever experiences cardiac arrest in my presence because I will have no idea what to do. Because at that time it was, infants were different than children and children were different than adults and all the different ratios and they were different. And so it was confusing to me. And I again left hoping that I would never need to use those skills, but it sat with me and I thought, you know what? We need to educate more people. The fact that I did not know about cardiac arrest prior to my incident, had never been trained in CPR. Defibrillators were something I just kind of saw rubbed together on TV, and that's not even the way that they work. And so I just really felt like there was a need to educate the public about cardiac arrest. And so also thought I'm going to have to, start instructing people myself about how to perform CPR because I found that when I was sharing my story with people, they were always so surprised, and most of them had never been trained in CPR. So I thought, well, I guess it starts with that. It starts with awareness and just really bringing that education to people. And so I thought, well, I thought through the process. I thought, why is it that people don't participate in CPR classes? Excuse me. And I figured out that it's cost. It's the commitment that you have to make. So it's an 8-hour, 4 to 8 hour long day. And
Right.
excuse me, my throat's hurting a little bit.
No problem.
I've been talking a lot. But I thought, okay, so I need to eliminate those barriers and I really need to bring the education to the people and I need to make it free because most people are not going to spend 60 to, $75 to participate in a certification class. Excuse me. So we have really bad fires in the area right now. And I've been trying to overcome all of the
Sorry.
air.
Oh, yeah.
Hopefully they go out.
Yeah.
Yes. So I started looking around, for other organizations, and I thought, well, what are other people doing to bring awareness to cardiac arrest? And I realized that, other than just the traditional certification classes, there really wasn't too much out there. But I also realized that that's what most people wanted at the time. Again, this is a long time ago, and awareness and education was not what it is today. So I decided to become an American Heart Association instructor, and I started just offering and advertising free CPR classes. And of course, I really couldn't do that and just myself, and so I decided that I needed to establish a nonprofit and established the organization Starting Hearts. And
Right.
again, the mission of the organization was to save the lives of cardiac arrest victims. And it was through CPR education and defibrillator access and awareness. And so I started teaching those certification classes and realized that the message needed to be simplified. Again, I went back to my confusion after the certification class and I started narrowing it down to, the most simple steps and came up with call, push, shock.
Hmm.
and coined that message um, and promoted that for many, many years and was able to provide that in class truly free to people. And it was much shorter. It was about 30 minutes and it went over just the signs of cardiac arrest and then how to perform CPR, hands-only CPR. Fortunately, the American Heart Association had come out with the hands-only CPR campaign around that time. So I was
Okay.
really, able to promote that
Yeah.
because again, people were associating breaths and that they were required to perform CPR.
Hmm.
Um, excuse me.
No problem.
And then I have like a follow-up just with the starting hearts and everything like that. So you mentioned the call, push, shock, everything. What does the starting hearts mean to you now and just that journey in general?
So, Starting Hearts was my first baby. I definitely refer to it as that because for a period in my life that I talked about in the first episode, um, I wanted to have a baby for a long time, and I put that off just so that I could establish this organization. I just really felt like if I'm not getting pregnant and, you know, um, easily and was having just such a hard time. I felt like, okay, I've got to use this time and this opportunity really to have children in another way. And again,
Yeah.
it became um, my baby, and it really was. And I put my heart and soul into it, and I put everything into that organization. I worked in 50, 60-hour weeks and didn't get paid a thing. And just really out of my heart and believing that it was the right thing to do, just continued with it. And it was really amazing to see how um, I do not like fundraising. I think most people do not like that, and it's
Yeah.
somewhat of a necessary evil. But um, it was amazing to see how donations would just come from nowhere, and people were encouraging me and just getting out there and sharing my story. People were so compelled and wanting to help and get involved. So it grew in many, many ways and evolved. And um, yeah, it's still operating and successful in our community today. And yeah, it's
That's
been
amazing.
life.
Now, you said in your is starting hearts. I know you just said it grew. It's still in existence today. Is that like throughout the country, or is it just more based in your town or in your state?
So they have some national efforts. I will say that I'm no longer involved with the organization.
Right.
So I don't know all the day-to-day activities, but
Yeah.
they are still active in placing defibrillators and promoting awareness and education.
Right. Well, that brings me to my next question. You mentioned, defibrillators, AED. So, I mean, I know you helped place those in, different areas in communities and have even seen that they have maybe saved a life. What's it been like to be a part of that and your impact on that?
We've come a long way with defibrillators. I mean, a long way since my incidents. And when I initially got out there to ask people to place them, it was a hard ask. People would not willingly place a defibrillator. So, we went to many of the like big box stores asking them to install a defibrillator, and many of them refused to do that. And they were worried about liability and that somebody's going to steal it and all of these unfounded reasons for not having a defibrillator, and so it was really overcoming their perceptions about the device, and we had to educate people
Right.
on why they needed to have one, and we still have to do that today, but not as much. And so when people would not willingly just purchase a defibrillator because they needed to, I thought, well, okay, fine. Then what about if I gave them the defibrillator? So I started, at that time, I called it an AED adoption auction. And
Oh,
so we
wow.
identified critical areas that needed a defibrillator and would ask for donors to help support that. And so, you know, that program evolved so much. And so initially people were placing defibrillators behind closed doors. They were in places that were not necessarily visible. And that's something that became very apparent to me. And so I realized, this is not the most efficient and effective place to have defibrillators placed, behind a locked door or, where it cannot be accessed. Also, the cost associated with equipping every single public place with a
Mhm.
defibrillator is, of course, very expensive. So when I started thinking
Right.
about it, I thought, okay, well, instead of going to 5 different restaurants, why don't I just go to one person to fund one defibrillator for all 5 of those restaurants, or perhaps go to all of 5 of those restaurants and have them equally, contribute towards a communal device. So this was probably about, I guess, 15 years ago when I first started this program. And now you might see some defibrillators outside in public places, but at that time they did not exist outside. And that was something that I really felt like needed to happen. They needed to be moved outside, again, where they're truly accessible, people see
Right.
them. And so that was a significant hurdle initially, getting buy-in from the public to place those devices outside. Also, we had environmental conditions that were challenging for us to overcome, the freezing temperatures and how that could impact battery life and the pads and
Right.
protecting them. And so we had just many, many hurdles to overcome in this process. But over time, we ended up getting buy-in from the community and placed hundreds of defibrillators throughout Eagle County, which is my community area, and believe that this particular area has the highest per capita potentially in the world of defibrillators. So I'm pretty proud of that. And
No, you
um,
should be.
also, living in such an international environment, we have people coming from all over the world to ski at the resorts. And,
Right.
we started placing defibrillators actually at the base of chairlifts. And in fact, some of those have been used as well. Um,
Awesome.
and so when people are out skiing, they're seeing this device and they are hopefully taking that idea back, to their own hometown communities. And I have to say that kind of came full circle a few years ago. I was in Rosemary Beach, Florida with my family, and we were walking along the beach and I noticed that at one of the end of the like walks down to the stairs down to the beach. It was a private access, and
Right.
they had a defibrillator, that was out and accessible to anybody that was walking on the beach. And I thought, I'd like to think that perhaps they maybe visited Vail,
Yeah.
and got the idea to do that. But I do hopefully think that um, that maybe influenced communities
Yeah.
elsewhere.
No, it's amazing. As you were answering that, I was just thinking like, wow, what a strong person you are and what thoughtfulness into the future you had because I don't know what it was like 20 years ago, but I know what I could see today. And, right, Jewel, like we were looking for AEDs, a few years ago and didn't really find them. And then,
Yeah.
Juliana was really pushing, with our town during my recovery about like AEDs and CPR training.
Yeah.
And it's just, such a need because like we said in episode one, it's part of your survival.
Hmm.
You need it if that have a cardiac arrest. But Lynn, I don't know if people think I've ever said this to you, but I will say it. You had who's your coworker that gave you CPR? What was her name?
Sue Freshly, Sue.
No, there was a woman, Sue,
Yeah.
Yeah.
Sue, and then Ryan and your other heroes. You needed heroes as your part to survive. And it's like you most likely have paid it forward hundreds of times and maybe never known it. But you're a hero to somebody that maybe that AED saves somebody's life. So it's just an amazing, story. Amazing.
Well,
That's
that's
all.
very kind of you, Rob, to say. I appreciate that. And, right back at you because, again, I can't
No
emphasize enough.
problem.
the work that you're doing and how important it is, because back when I survived, and I didn't know another survivor. In fact, social media wasn't around, and there was
Yeah.
no way to connect with anyone who had experienced cardiac arrest. And so the first time I met another survivor, it was really a pretty unbelievable experience, because you're able to instantly connect on a much
Yeah.
deeper level. And again, just what you're doing is critical. So it means a lot for you to say that, coming from you. So thank you.
And then you've also worked on legislative efforts and in statewide initiatives surrounding sudden cardiac arrest awareness and tracking. Why do you feel like these larger systemic changes are so important?
Well, that really is a very deep and detailed question, or the response, I should say. Um, so my spiel, I guess, historically has been data, definition, and dollars. So, first of all, data is the most important aspect of cardiac arrest that needs to be addressed. And so, back when I established Starting Hearts, I was applying for grants, and um, the most common question in a grant application is, what's your data? How many, lives are being saved, and how many people are experiencing cardiac arrest? Um, they want to know these numbers. And so I started going to various organizations in our community, asking for the the data around cardiac arrest, and nobody could give it to me. So the paramedics couldn't, the firefighters couldn't, our local health agencies could not, the hospital could not. And so I started, just kind of looking into that a little bit more. And I thought, why is there no data about cardiac arrest? And
Yeah.
so I actually had a paramedic friend that ended up telling me about this book. She said, you need to read this book called Resuscitate. It's by Dr. Mickey Eisenberg. He is basically the guru of cardiac arrest and response in communities, and he'll basically spell out for you how you need to improve survival in your own community. So I had already identified the education component and placing defibrillators, but he really laid it out in a way that was more scientific. And it what they had done actually in Seattle, so the Medic One program up there has been very successful, and they've always achieved much higher survival rates and have documented that. And so I tried to see, well, how are they documenting those survival rates in their community, which his book Resuscitate outlines, which then led me to CARES. And CARES is Cardiac Arrest Registry to Enhance Survival. It is a program that was put together by Emory University and the CDC, and it is a voluntary registry that communities can implement and track data. So I thought, okay, well, then that's my solution. I'm going to make sure that we can get CARES implemented in Eagle County, so that I can start tracking survival and hopefully start getting some money, some funding, for this organization. But that wasn't necessarily easy either. Again, it's voluntary. Organizations are already tapped. They don't have, endless dollars, and they don't have extra employees to start, documenting another thing. And it's not mandated. So, again, why would they do this? And so I went to the paramedic agency, and they were reluctant at first. And so I said, okay, well, fine. If I find, the money for you guys to implement this registry, will you do it? And so fortunately, it was a fairly low cost for integration at that time. It was only like $1,000. And so I found the $1,000, and I paid for them to start the registry. And so then we started tracking the data. And so that was critical. But that also, led to other just other things that I realized now needed to happen. So not only do we need CARES in our community, we need this nationwide um, and throughout the state. And so again, starting with data, I'm getting kind of sidetracked on the original question, but so okay, so also the definition. Um, there is not a clear definition
Right.
of cardiac arrest, and so many times I hear that so and so died of a seizure, or someone died in their sleep, or someone died of an unknown cause of death. And um, so frequently, cardiac arrest is not reported accurately. Well, first of all, they don't have cares, but there's also no formal definition of cardiac arrest. So, you know, also, the term heart attack and cardiac arrest are used interchangeably.
Yeah.
You may have heard the analogy that a heart attack is a plumbing problem and a cardiac arrest is an electrical issue.
Yep.
So that's a very common way for people to understand it, but they are two very different events. But where it gets confusing is that a heart attack can escalate into a cardiac arrest. And so
Mhm.
yeah, so but a heart attack isn't necessarily what causes someone to die. It's the cardiac arrest, not the heart attack. So
Right.
um, so there's just so many like complications and little nuances that have caused cardiac arrest to fly under the radar, and it has for way too long. And we we just have to have more awareness around it. But it really, I think, starts with providing that proper definition. So, we need organizations like the CDC and the all of the national entities and even global, really, to come together and say, well, this is specifically what cardiac arrest is. And if there's no other suspected cause of death, then it needs to be documented as a suspected cardiac arrest, and that also needs to be documented. So something that and I could go down the rabbit hole for this on this for a long, long time. But one of the challenges with the CARES data, as much as I love CARES and I'm an absolute proponent of the effort, and the one area where it's lacking is the fact that it does not track deaths that are or incidents that are not responded to. So it has to be a witness worked arrest for it to actually go into the registry. So let's say that, um, you know, someone died in their home, maybe their spouse didn't find them for, a half hour. They were not worked, essentially. So
Hmm.
that case would not be necessarily documented. So,
Crazy.
who knows how many cardiac arrests are actually happening? I feel like around 350,000 is kind of a common number, maybe even up to 425 that's been, thrown around for cardiac arrest incidents. But it doesn't account for so many cases that we're not considering. So again, yeah, it goes back to that definition and making sure that there's a clear understanding of, um, the etiology of cardiac arrest and
Yeah.
document that properly. And because of those two subjects, the data and the definition, we're not getting the dollars to address cardiac arrest. And so again, that's why it continues to just fly under the radar. Um, did that answer that question?
Yeah,
Yeah.
I think it did. I mean, are there, in part of the question, was legislative efforts. How many, how far did you go, before you said, oh, let me step backwards? But, did you go to your state? Did you go to the national government? Like, where'd you go?
So it started with wanting to place those defibrillators and places. And like I said, we, went to some of the larger stores, and when they were saying, no, we're not going to place it. And we thought, well, how are we going to get around that? I started looking at the existing state laws, and they were somewhat outdated. So in the state of Colorado, it was a requirement that if a school was given a defibrillator, they must place it. Okay. So, um, I thought, well, how come we can't expand that to all businesses? And, let's say I go down to Walmart and I give them a defibrillator, can they actually reject that? Or I want them to accept it, not turn it away. And so I had a relationship or ended up being introduced to a local state representative who was open to um, trying to pass a law that would expand that coverage to require all establishments to um, to be forced essentially to accept a defibrillator if they were given one. And so we started with that, and we were successful in updating that law, which didn't really do too much because, right, you've got to find the funding to be able to put the defibrillators out there to begin with. So it maybe is helpful, but regardless, it was a starting point. And so at that point in time, I
Right.
said, Representative Roberts, this is a great start, but there's still so much more to be done. And I, at that time, told him that I wanted to come back and at some point require that all agencies in the state of Colorado start tracking cardiac arrest. And so a few years passed, and I thought, okay, this is the time we need to get cares throughout the state of Colorado. And it's interesting, again, how much pushback you get from different organizations and wanting to
Right.
try to just save lives. But, they see it as it's more effort and more work for them. But regardless, I went back to, he was now a state senator, Roberts, and told him that I wanted to try to pursue making cardiac arrest a required condition that is reported in the state, and he was receptive. And so at that point, I just started looking at other states that were kind of doing, I guess, maybe some of the same, but really there were no other states that had mandated at that time. I think Georgia had done something. And so I kind of used that as a frame of reference, but
Right.
really expanded it. And we ended up getting that legislation passed in the state of Colorado now that funds the Office of Cardiac Arrest Care or Management, and so um, they manage the whole CARES program for the state, and now provide the
Awesome.
funding mechanism for that program to continue statewide.
Yeah.
So I have actually bigger aspirations, though. I'd like to really do it nationally,
Great.
much more than just a registry. I think,
That's uh that's
Yeah.
amazing.
Hmm.
Right, Joel? I mean, without you, Lynn, and well, now he's Senator Roberts, is he still in place?
he is. Yes, in
You
fact,
know,
I
great.
believe maybe going to be our governor someday.
Good. Hopefully,
Yeah.
I mean, if he didn't support you, who knows what could have been.
You
Yeah.
know,
Found
Agree.
someone that had an open ear and sympathetic and understood and cared, right?
Yeah.
and he is actually a fantastic individual. I will say, I feel like we really connected on a personal level. He lost a brother actually to diabetes, and
Okay.
when he was young, and uh, Senator Roberts is actually young. He's younger than I am too. So we connected on many levels. But he ended up that same year actually getting another piece of legislation passed that has revolutionized um, EpiPens and
Oh, wow.
wait, not EpiPens. It was I'd love to edit this part because that was the wrong. Um, it is the diabetes medication. I guess it was the insulin
Yeah.
injection. That's why I went. That's why I said EpiPen
Oh, yeah,
because
EpiPen. All
it's
right.
the insulin injection. But anyhow, so he was able to get the cost for accessing that essential um,
That's
care
awesome.
for patients. So
Yeah.
yeah, so he is a very influential person. I am so grateful and thankful to know him. And sorry for that little blip. That's also what I
It's
like
okay.
to chalk up to being a cardiac arrest survivor and not being able to recall things in the moment sometimes.
Hmm.
You know what? We all we have it, but I think, as like you said, SCA survivors have it a little more often, some more than others. Um,
Yeah.
it's okay. So,
Hmm.
you know, uh, next time you speak to him, say thank you from us. We
Yeah.
appreciate his efforts, and it's a wonderful thing. Wonderful thing. I was lucky enough, to about 2 years ago to see a post on Facebook in one of the groups. And that was a post from Lynn asking the post was about, would someone be interested in reading my manuscript? Right, Lynn?
That's right, Rob.
Okay. And Rob said, I would love to. And you were kind enough to share your manuscript with me and then take some suggestions, because you were open to that. And I wasn't the only one, I know, but I could only talk about me. And I really enjoyed doing it. And then a while later, I don't know, what was it, about a year and a half later, I think I get an email saying, it's soon to be coming out. Uh, I've made some changes, you're going to really like it. And then I said, just do me a favor. When it comes out, here's my address. Could you just sign it and send it to me?
Hmm.
So early February of this year, I get a package. And I open the package and I have this in the package. I'm not trying to get it to come out good because I know,
The
but
background, up.
uh,
You cannot see.
yeah,
Yeah.
but let me fix it. But I get Lynn's book, Heart of the Matter. And so you wrote this book. What inspired you to write the book, and what parts of your story you feel are most important to share with the book's readers?
Well, Rob, first of all, I want to touch on that response in your reply to my message because I actually worked with a writing coach to produce this book, and that's part of the process. Is you have to have first readers and to give you feedback and make sure that you're on the right track with your content. And I'm like, where am I going to get a first reader? Really didn't know who to ask, and so you replied as well as a few other people, but you were definitely the one that was the most responsive and most willing and provided the most critical feedback. So thank you for that. And super meaningful. But the reason why I ultimately decided to write that book is because I felt so alone after surviving. As I mentioned earlier, I didn't meet another survivor for quite some time. And I scoured bookshelves and libraries and internet was still fairly new. Amazon probably was too.
Hmm.
So I couldn't find a book anywhere. I felt like no one could relate to me. I was surviving this and all alone. And I was just so desperate to hear of another person and their experience. And that again goes back to the importance of what you're doing, and how you're connecting people and encouraging others. And it's just so critical and our mental health and our ability to be able to progress and go on as survivors. And so not having that reference or a book at that time. So now, there are a handful of books available that are typically self-published by cardiac arrest survivors, which is great. And, but just really needing that myself. I thought if that was so important to me, surely it would be important for other survivors. And so, it took a long time to get to that point and to be able to do that. And that was actually a probably 5 to 10 year process of writing that book.
Well, your book, uh, also, I didn't share, but let me see if it'll pop up here. You were kind enough to there's a card, and in the front of the card is the front of your book. Inside is a nice write up, and then in the back is a picture of you, your husband, and your son. And again, very touching and appreciated. But I think I read your book within a day or two. Very addicting, very heartfelt, connected. And, I remember, when I read your manuscript, and I was blown away by your advocacy. And I felt like you're the one that taught me that this is something that I need to do. I need to find my lane. And, thankful to Juliana and my family, my wife, my son, helping us in, creating a group on Facebook. And then, Juliana and I doing this podcast, and anybody that's willing to come on it, it's just spreading the information, So I felt this was my lane with the support of my family, but I would have maybe never gone this far without learning by you as a trailblazer. So thank you.
Mm-hmm.
Too kind, really. Thank you. I'm many people before me, but we all just have to do our part, and whatever it is that we feel like we can do to contribute to, the greater good and advancing it. But thank you
Yeah.
for those very kind words, Rob.
And for someone listening who may be a survivor, a caregiver, or a family member walking through fear and uncertainty after a sudden cardiac arrest, what message or advice would you want to give these people?
Um, Hope more than
Mhm.
anything, just that life is still good,
Yeah.
and that longevity is possible. And cardiac arrest isn't a death sentence. And there are other people going through the same situation. Reach out to them, connect with them. Um, I also want people to be aware of cardiac arrest happening around them. So even if it's not a fellow survivor that might be watching this, but if it's just anyone, just knowing how to respond and knowing the signs, as we talked about, and it's the sudden collapse, and it's not breathing, it's gasping, recognizing cardiac arrest, and then knowing how to respond. And I now have a new campaign, a new message that I'm promoting for the 3 simple steps to save a life. And it's super easy to remember. If you just think about CPR, it's call, pump, restart. So first, call 911. Second, pump the heart and get that blood flowing. And then third, restart the heart using a defibrillator. You never know when somebody will experience cardiac arrest, and just being prepared is so important. And so, if it's a loved one of a survivor too, also knowing how to act, and encouraging people not to be afraid to do something. It's always better to do something. I also want people to know about the Good Samaritan laws, and that they would not be held liable if they, were to act, and just to do something. Doing something is better than nothing. Um, Yeah, but I think really more than anything, I just want to give people hope, and just encourage them that, that they can go on. So I now have outlived that life expectancy almost, by 3 times.
Yeah.
Um, just because someone tells you that you might not survive, or because you feel like you might not, just don't let that, don't let that get you down, or I don't know. I just hope people are encouraged after hearing my story. So
Yeah.
Definitely. Well, we want to thank you so much. Your journey is one of transforming pain into purpose and helping save countless lives.
thank you, Rob. It really was a pleasure visiting with you and Juliana. And again, I can't thank you enough for all of the work that you've done. And just if people are interested in learning more about my story or my book, they can visit the website hearthope.org. And I have not been as active on social media and some of these things, just because I've been busy with my son and all kinds of just living life, frankly, which is
Sure.
Yeah.
great, and which has been fantastic. But
Good.
I
Good.
hopefully will be posting updates and getting more on social media, and
Yeah.
just getting heart of the matter out
Well,
there.
I'll try to link the website and the book in the show notes as well.
Mhm.
Appreciate that.
To anyone listening, whether you are a survivor, a loved one, a caregiver, or someone simply wanting to better understand sudden cardiac arrest and mental health, please remember that your experience matters and that you are not alone. If this episode resonated with you, you could share it with someone that may need it. And take care of your mind, your body, and your heart.
Please rate and review the podcast. If you're interested in being featured on the podcast, please email us at sca smha@gmail.com.
You can also follow our Facebook group, Sudden Cardiac Arrest Survivor Mental Health Awareness, where we continue conversations around healing, support, and life after sudden cardiac arrest.